One of the things that I actually get asked quite a bit is, what does that first therapy session look like? What can I expect when I walk into the room? So, most therapists will either have you fill out an intake questionnaire prior to your appointment in the waiting room, or they'll go through that intake questionnaire that first session. And some of the questions that folks can understandably experience some anxiety about beforehand are those history type questions. What's your family look like? How were you raised? What types of symptoms have you experienced in the past? What types of symptoms are you experiencing now? And by symptoms, therapists generally just mean things like, what does your sleep look like? Have you ever felt suicidal? Do you eat on a regular basis? Are you feeling depressed? Do you have anxiety? And what does that look like for you? So that the therapist can get on the same page as you about what it is you're unsatisfied with right now and what you're looking to change. A lot of folks don't know that actually the therapist wants you to ask questions during that session as well. You're hiring the therapist for a job, so to speak, and you want to get on the same page with the therapist about what exactly that job is. And then the therapist can get on that same page with you and say, okay, you're hiring me to do X. This is how I might help you achieve X. How does that look for you? And then you guys can collaborate about what that process will look like. So basically, your job as the client is to become a consumer of therapy. I want to hire you, Rika, or whomever, to help me achieve X. And this is why I think X is happening for me right now. And these are the things that I want to focus on to get to my desired outcome of Y or whatever, right? So you asking me questions in that first session will help us both. If you have questions about what's expected of you as a client, if you have questions about, what will we focus on? I really want to focus on the present because that's what's really bugging me right now. And I don't really want to go back and focus on things that have affected me in the past. Some therapists will say, yeah, I can absolutely do that. Let's only focus on the present. And some therapists will say, hey, the way that I work is, I really don't believe that we can do present-centered work without focusing a little bit on the past if I see that something in the past is really the thing that I feel like is holding you back. So all of that to say that therapists work differently and clients work differently. If you guys have an open and honest conversation that first session, you sharing your history, the therapist sharing their modality and the way that they work, you guys can really suss out in that first session if you guys are going to be a good match for each other. So you asking questions is just as important as them asking you questions. You're both trying to get a sense of if the two of you will work well together. I hope that helps.